Agenda, all the following items which concern reports and items of a routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all of these items. The consent agenda consists of the discussion, consideration, and action on the following items. The minutes of the regular trustee meeting September 27, 2022, minutes of the special finance meeting September 27, 2022, minutes of the regular finance meeting October 18th, 2022, and a check report September 9th, 2022 through October 8th, 2022.
I move we approve the consent agenda, items A through D as printed.
Second.
I have a motion by Dr. Brown, a second by Dr. Simon to approve the consent agenda as it was presented. Roll call vote, please.
Gaspard?
Yes.
Simon?
Yes.
Brown?
Yes.
Bowman?
Yes.
Okay, next item is the CEO's report. Candace?
All right, as you can see from my report, we've hired some new staff, and I would say that for the most part, we've got all of our positions filled except maybe for a couple in nursing, so that's helpful. I know Angelica would agree with that.
Yes.
We recently, last week, had our benefit open enrollment period and got all of that taken care of. We have made some changes to our PTO policy. We will allow them to buy back some PTO overage within a period of time. Typically, I think we're going to do maybe February or March through October that they'll have a buyback period. If some of those positions, they don't have to use their PTO because of the nature of their schedule. And so if they need to take off or take a vacation, they just schedule around that and their PTO gets built up. So we're going to allow them to buy that down. HR is currently doing a wage analysis across the board at all facilities, and we've received the 22 OHA data we paid to participate in that survey. So we will be taking a look at our wage matrix to, obviously we want to remain competitive in the market so that we can recruit and maintain the current staff that we have so that they're not chasing money. So we'll be taking a look at that. You can see some of our statistics there from HR that we like to take a look at, see how we're performing. IT has been a challenge the last few days. Before I came in, I received a notice from OHA. The threats of hacking have really been turned up, and the government, FBI, and all of those agencies are sending out warnings to healthcare, to hospitals. So we hate to hear that. Scary. You can see what we've done in the surgery department. It looks good. They got the walls painted, the carpet in, and as far as our project moving along, seems to be going kind of slow at this point. We should be finding out, I would hope in the next couple of weeks, whether we've got a surgeon or not, and just kind of taking that day by day. By the way, the supply chain management guy that we talked to yesterday, they are able to do competitive pricing with the manufacturer that does striker stuff. It's the same stuff, it's just branded differently. So that's interesting. We'll talk more about that here in a minute. Nursing students, maybe you saw on Facebook, we've had Northwestern students here, and they finished up their clinicals last week with being able to poke the nurses and learn to start IVs. So that was fun for them. Current projects, Meditech as a service, not really a lot to report. I'll leave that to Angelica, she's our project lead on that. The IV infusion contract is on hold. We have moved that to on hold. We just didn't feel like that the return on investment was enough to warrant pulling us away from other projects to focus on that. So That was, I think, about a $24,000 outlay in cash, and it would take us a while to recoup that, so we're going to put that on hold for now. Not that we won't pursue it, we will at a later date. Supply chain management, we're currently in the process of interviewing vendors to, Anita is getting to the point of retirement, and that leaves us in a position to figure out what we're going to do going forward with our supply chain management. You probably remember me saying I feel like that's a huge opportunity for us to be able to save some money, something we haven't really focused on much in the past, and this gives us an opportunity to do something different in that area. We had a vendor on site yesterday, and interestingly enough, the technology was developed in Tulsa. His computer programmer is out of Broken Arrow, and relatively a new startup company. This one's a couple of years old that we looked at, but they provide manufacturer to consumer supply chain management, and they do everything up to implantables devices, and so they don't do pharmaceuticals. That is the one thing they don't do. But so it's interesting. We're trying to learn more about it and figure out what's best for us to do. So we'll have more on that next time. Like I said, the providers have been super busy in their clinics, which is good. It's a bit of a challenge trying to get that many new patients. Those are typically an hour visit to bring a new patient on board. So when you've got 6 or 7, I think one doctor had 7 yesterday, it's a little stressful for them. So we're trying to figure out how to help them. Dr. Soft's plaque is now up and hanging next to Dr. Berry's. So if you have a chance to wander up that way, take a look at that. It's really nice. The remodel project is not finished yet. We're getting closer. The RHC downtown still don't have a date for survey, but they are ready for that. And then the exciting news is that we will be able to do 340B in that to be able to get that from specifically Dr. Burke's set of patients. And then we found out we're looking into being able to, that came out of my St. Anthony meeting last month, to be able to capture specialists that Dr. Burke's patients see out of town that order drugs, some of those drugs that are 340B, and we'll be able to hopefully capture those as well. So that should provide us with a pretty good chunk of money each month. Do I have anything else? Do you guys have any questions for me?
What is 340B? I don't know.
It's a drug program that, just in a nutshell, not all drugs, it's not all drugs, it's specific drugs that are on a list, and those patients that, it's good for the patients because they get them at a reduced cost, but we also get a cut of that money from the manufacturer in concert with Holder Drug and Walmart. So they make a little bit off of it, we make a little bit off of it as well, and it's to help those patients get it at a reduced cost. Do you have any questions for me?
I move that we approve the Share Medical Center written report for October 25th, 2022.
Second.
We have a motion by Dr. Simon, a second by Greg Bowman, to approve the Share Medical Center written report for October 25th, 2022. Roll call vote, please.
Simon?
Yes.
Brand?
Yes.
Bowman?
Yes.
Esper?
Yes. All right, Candace, thank you. Next is the CFO's report. Angelica.
All right, so operating cash finished out the month of September at about $77,000, which is 2.3 days of operating expenses. Our cash was down at the end of the month. A couple of different issues. We were still working to correct our Medicare reimbursement issues. Those should all be resolved as we moved into October. They're all taken care of now, but it did impact our cash flow in the month of September. We also had Friday, the last day of the month ended on Friday, so we run our AP on Fridays as well. So we had 5 AP runs as opposed to 4 AP runs a month, which kind of has a little bit of an impact there as well. Our hospital AR is up to about $97,000. It's up $97,000. Oh my goodness.
Yeah.
I wish it was
Wow.
$97,000. That's right. No, it was up $97,000. Part of that is due to the Medicare reimbursement issues that we were working through. The good piece is that it only impacted our gross days in AR by about 1 day. It went from 82.3 to 83.3. Our hospital AP increased due to those cash flow issues. We did have more AP runs. However, we weren't able to pay as many bills because our cash flow was down, so that there was an increase there. Our gross patient revenue was at $1.74 million for the month of September. That was up about 8% over the month of August. Year to date, we're at $4.7 million, which is about 20% of the budgeted revenue we have for gross patient revenue. We really ideally should be about 25% of our budget at the end of September. So we're a little bit under where we need to be there. Our write-off collection, we did not have any write-offs to the collection agency in the month of September. We transitioned to a new team lead with TrueBridge and slowed the process down a little bit, so we did get that done towards the 1st of October, and we're hoping by the time we get to November, we're back on track, getting that done on a monthly basis. I can't talk tonight. Hospital operating expenses are at $1.15 million for the month of September, which is an increase of about 11% over the month of August. Year to date, we finished out September with operating expenses of $3.3 million, which is 25% of the budget for the year. So we're at 20% of our operating budget, but we're at 25% of our expense budget. So in our department meeting last week, we had a conversation with staff explaining to them that right now we're spending more money than what we're bringing in. And as a result of that, we need to really be looking at expenses and making sure that the purchases that we are making are truly necessary. And I felt like that was very well received. And Candace, do you feel that as well? Just giving them some awareness that maybe they haven't had in past years. So hopefully that will help get those expenses back on track. That is pretty much the financial statements in a nutshell. Do you guys have questions that I can answer about the financial statements? Pretty talkative bunch tonight. I can talk a little bit about the projects that we have in the finance world. So as Candace talked about with Meditech Expanse, we did get to meet our project manager this month. She will be on site in November and in December as well. We're really starting to get to the nuts and bolts of what that's going to look like. We've met with the point person who's helping us kind of identify what structure we need to have for the software, what that's going to look like. Just working on getting some of those to-dos checked off the list. We will get access to the software on January 1st, so that will be when I think we get extremely busy with that project. Our auditors are on site currently working on our annual audit. So far that seems to be going okay. We did get our charge description master review completed. We got the report on that in the beginning of October. Forbes presented that information to us and identified some things that we need to work on. We did learn that the Office of Rural Health has some additional grant money available to us so that we can work with Forbes to basically create the plan and implement a plan to get that corrected in where it needs to be as we move into the Meditech Expanse implementation. We also started working with a company called Invitify. I think Candace talked a little bit about this last month. We're going to start implementing this program that allows additional financing options for our patients. It will help those patients who have the high deductible health plans. It gives them some options, and so when you have to have a $2,000 or $3,000 worth of expense, out-of-pocket expenses up front, it allows them some financing options. It will also help them with any old balances that they have on our books, allow them to finance that through this company, and then we get our money up front, and then the financing company works directly with the patient after that. So it is non-recourse financing option for our patients, so that's a very...
They handle all the calling and all that stuff, we don't have to do any of that in-house?
Yes, ma'am.
Which should improve our cash flow.
Yes. Is there any other questions I can answer?
Another thing you're looking at was new software that would also help with the billing up front. Right? We talked about that in finance. We're looking into it.
Oh, medical necessity.
Oh, yes. So we're working with a company called Craneware, and it's a company, they basically would help us. One of the biggest areas where our coders have to touch every one of the claims is if there's medical necessity, and so this will help identify medical necessity so that it can be put in appropriately, and we don't have to touch every single one of the claims that are going out for that.
Any other questions for Angelica? If not, item B, we need to table that till next month. Need a little bit more information on that. So I would entertain a motion to table that item.
I move to table the discussion and action to approve or disapprove Westcom nurse call system of Index of Oklahoma Inc. in the amount not to exceed $199,187.88.
Second. I have a motion by Dr. Simon, a second by Greg Bowman to table the Westcom nurse call system with Index of Oklahoma Inc. in the amount not to exceed $199,187.88. Roll call vote, please.
Brown,
Yes.
Bowman,
Yes.
Casper,
Excuse me, yes?
Simon.
Yes.
All right, great. Angelica, thank you. Next item is the Medical Staff Executive Committee.
But me,
Yes, you.
Dr. Burks did not feel well and is not coming tonight, so I will fly through his report. Looks like we need to reappoint to allied staff in Holderby, APRN.
I move we reappoint allied staff when Holder will be APR.
Second.
Dr. Brown, I have a motion from Dr. Brown, a second from Dr. Simon to reappoint to allied staff Gwen Holderby, APRN. Roll call vote, please.
Bowman,
Yes.
Casper,
Yes.
Simon.
Yes.
Brown.
Yes.
Next up is the appointment to active staff Brian Cook, DO, who's our ER provider.
Make a motion to appoint to active staff Brian Cook, DO. Second.
Have a motion by Dr. Brown, a second by Greg Bowman to appoint to active staff Brian Cook, DO. Roll call vote, please.
Casper,
Yes.
Simon.
Yes.
Brown,
Yes.
Bowman.
Yes.
All right. Thank you all. Quappy?
You guys probably read your copy report and have lots of questions. What can I answer? As I'm flipping through there, if you guys have not, we've started including, I know we're past this, but month-end reports that you're not used to getting. If you'll look back through there, there's a lot of True Bridge reports, HRG reports that you can see that we are making improvements. So just in your spare time, you might want to look at those. As far as quality goes, so we continue month over month to improve our use of SQSS, which improves our overall quality program. We have a quality director, which is Coco, but when we lost our last quality manager, we decided to, honestly, Coco is the quality director in name, but all of our managers have more responsibility today over quality than they've had in the past. And you can see this report just continues to get bigger, to grow, and that's because I think we're growing and understanding more of what we need to track and trend. And so I'm pretty excited about our quality program. So if you see anything that you want me to try to answer for you, I would be happy to, but I'm not going to bore you with going over the entire thing. It's a lot.
Anybody have any questions about that? If not, improvement to patient care.
We just had 3 contracts this time. We archived one, the other was Paycom and Northwest Physical Therapy, and those were both good.
Okay. Then the next item is discussion and action on the revisions report.
So again, that's just our policy and procedures that we bring forth with new or significantly changed policies and procedures.
So we have 3 of them that need to be done. The first one is the revisions report. Then there will be the refunds to patient and or payer policy, and then the occasional part-time employee policy. We need to do those one by one.
Make a motion to approve the revisions report dated September 30, 2020.
Second.
I have a motion by Dr. Brown, a second by Dr. Simon to approve the revisions report dated September 30th, 2022. Roll call vote, please.
Simon?
Yes.
Brown?
Yes.
Bowman?
Yes.
Gasper?
Yes. The next item is the refunds to patient and or payer policy.
Make a motion that we approve the refunds to patient and or payer policy. Second.
We have a motion by Dr. Brown, a second by Greg Bowman to approve the refunds to patient and or payer policy. Roll call vote, please.
Brown?
Yes.
Bowman?
Yes.
Gasper?
Yes.
Simon?
Yes.
And the last one is the occasional part-time employee policy.
Make a motion that we approve the occasional part-time employee policy. Second.
We have a motion by Dr. Brown, a second by Greg Bowman to approve the occasional part-time employee policy. Roll call vote, please.
Bowman?
Yes.
Gasper?
Yes.
Simon?
Yes.
Brown?
Yes.
All right. Thank you all. Next is the Share Convalescent Home Report. Kelly?
Start with the finances for the convalescent home. We had an operating cash balance of $287,812, and that represents 32.2 days of operating expenses, excluding depreciation. AR has a balance of 1.49 million, and that's a decrease of 26,752 for the month of September. You see our gross days in AR there in the report. Accounts payable balance for September was $40,600. It's 12 days of operating expenses. And gross patient revenue for the month totaled $184,000, which was $20,000 less compared to the prior month, and it's still significantly lower than what we've been averaging. We have seen, well, I'll get that in a second. Operating expenses for September totaled, is that right? Excluding salaries, benefits, and depreciation, $107,000, which was down compared to August. And then also salaries were at $142,000, which was also down about $26,000 from August. And we had a net operating loss of $90,000 for the month. And we're running about a year-to-date $178,000 loss. August and September were terrible census months. We have seen an increase both in terms of total census and in terms of our Medicare Part A census. We have seen an increase in October in both, and so hopefully we'll start to see that impact on the financial statement moving forward. We have reviewed Social Security's cost of living adjustment for the coming year, and there will be rate increases per our policy in accordance with the cost of living adjustments going into effect. Those will take effect January 1st. So,
and are those increases, I mean, if they're 5%, are we 5%, or?
historically, that's what we've done.
Okay. I just knew this one was large, so I didn't know.
Yeah.
if we were-
And we don't have to, we haven't set that number yet, but our policy states that that's the basis for how we.
Gotcha. Okay.
It's not necessarily the exact percentage. We could do a lesser amount if we felt that was more appropriate for what we needed. So. Any questions on the convalescent home finances?
And Kelly, I know that sometimes there's those happy mediums where sometimes less is more, but how far are we from that, or do you know?
We need, are you talking about our census? We probably need to be running, for our current staffing, we need to be running around 34, 35. We get to that point, and then we start, our margin gets quite a bit lower. If we add more staff to be able to add more residents, we need to, probably add another 8 to 10 on top of that to justify the increase in staffing. So we do kind of, right now we're not where we need to be on census, but we are where we need to be on staffing. We finished, let's see, September we had decreased our agency spend, and then on October we decreased that even more. I'm not sure if we've had any agency spend in October. So we've added staff. We're getting back to the point where we can better take care of the people that we've got and hopefully can add. And honestly, probably bigger than our total census is our percentage of Medicare. So.
Right. Right. So you're not chasing.
Any other questions on the finances? You can see the written report in there. As I mentioned, we did have a decline in census. Our active daily census was 29. Our total paid days were 876, which was a huge decline. Skilled nursing facility, those are our Medicare Part A days, SNF days. We're at 12 for the month of September, so that's not going to cut it. We're going to be 2 or 3 times that in the month of October, I think, which is getting, it's not quite where we need to be, but it's considerably better. And then our DHS days are down as well, and DHS days are going to be roughly just a little bit under what our daily rate is, so. We only had, compared to August, which we had 6 deaths in August, we only had 1 death in September. And we had 1 discharge. As far as our quality measures are concerned, we're, the black and white copy you can't really tell, but the categories for UTI, weight loss, and the use of antipsychotic medications, we are where we need to be on those items. We have some work to do with our pressure ulcers in high-risk patients. Call times are good. Our satisfaction survey results for residents are either at or above the benchmark for the company we use, or they're not too far behind. I'm not sure why our satisfaction with transportation is so low. It just doesn't make any sense. And I need to dig more into that. I think it might be something about the questioning and if they're understanding it properly, because we do an excellent job of that. We've got new vehicles, so I'll see what's going on there.
Maybe they want to go to the bar instead of the hospital.
They might. But we are always taking them to, now we've started going to beauty shops, so I mean, that might improve
Might
things.
improve the.
You're not a casino, that's what they want, a casino.
They don't like going to the dentist, but beauty shop might be a better deal.
There you go.
We got some new LED lights installed in the solarium. It used to be really, really dark in there, and it looks, it's incredible, if I'm just going to be honest. It's as bright as this room, and so that's real nice. I'm wanting to probably, as far as our HVAC project is concerned, I'm probably going to want to talk with you guys, maybe Finance Committee, about maybe looking at a different way to go about accomplishing this. So, because it's dragging on too long, we continue to have issues at times, and we need to get that figured out. As far as staffing is concerned, we hired a new person in housekeeping and a new person in activities. In September, we didn't have anybody leave. Bailey Miller completed her coursework for LPN, and we're waiting on her to test and get her license, and then we'll have another nurse. And she does plan to stay with us when she gets her LPN, so we're excited about that. You can see our employee satisfaction numbers right there below that. We've had really good improvement versus previous months. Almost all of our areas are meeting the benchmark nationwide. We had 11% improvement on our staff feeling appreciated, and we're just right below meeting the nationwide benchmark. And then our overall job satisfaction had a 5% improvement. So we're still trying to get that worked out. But 100% of our staff feel comfortable and safe. 94% recommend this to family and friends. Where I feel really good about both of those categories and how the staff are doing. I mentioned that we reduced our spending on agency. We did have a audit regarding the pay for performance program, and we submitted a corrective action plan with that, and it was centered around our quality improvement plan. I attended the Care Providers of Oklahoma conference in Tulsa. You've heard me talk probably in the past, and we received some awards from the Leading Age Oklahoma. Care Providers of Oklahoma is another organization for long-term care providers, and that's all they do is long-term care providers. Leading Age does long-term care, but they also do community-based services and some other senior services type things. But there was really good information coming out of that. We learned about some changes in what Medicare is going to expect of us in 2023. And of course, none of it's going to be popular. We're going to have to change some of the things we're doing. We're going to have, never has Medicare implemented a change that didn't cause more burden for the providers. And so I'm not entirely sure that it's going to improve resident care. So, but, you know, we're going to have a license, we're going to have to do it, and so we'll move forward and do what they ask us to. That concludes my report. Happy to try and answer any questions.
Any questions for Kelly? Okay. Next will be the homestead report.
Homestead financials. Homestead had just a slight reduction in revenue, about a about $4,000 reduction in revenue compared to August. But for the last 6 months comparison, you can see that it's still a pretty good increase over what we had been experiencing. The expenses for the homestead were at $49,000, almost $50,000, which was about a $4,000 or $5,000 increase over October. And so with that all together, we had about a $10,000 net income. Year to date, operating revenue is basically even with 2022, with fiscal year 22, and operating expenses are down slightly, so our net income is up slightly versus last year to date. Any question on the homestead finances?
Usually during the holiday time, isn't that kind of where you guys pick up?
I've never been able to trend it. I've tried to trend it.
No.
It's been very unpredictable. That makes sense, but it didn't always happen that way. That when families come home to see their parents or grandparents or whatever, and they say, "Oh, Mom's not looking too hot," you know, or whatever. Mom needs help with the chores or whatever those conversations are. I do feel like that happens, but it really hasn't ever been something where we tracked it. It showed itself out in our numbers.
Okay.
So we have done some advertising in the Enid News. They do a medical directory, which we generally get, at least a handful of referrals in that. We've been doing that for the last, 7, 8 years. I don't know, I started doing it before I left over there. And so that's a pretty good deal. We're in there, for all the folks that are sitting in a waiting room in Enid, Oklahoma somewhere, that if they pick up that medical directory, we're in it. So, and we do get phone calls and we do get referrals from that. The occupancy is for September was up about 2.5% compared to August. We have apartments available, so we're ready to help people out and get them in there.
It seems like the current trend, at least since COVID, has been probably both with the nursing home and homestead, is downward. Do we think that that's going to change? I mean, any conferences that you're on? I mean, or is this a wait and see game?
Well, I don't think it's wait and see. I think you have a good number of people that aren't interested in, communal living. But I think, we are really starting to see baby boomers. The numbers of baby boomers or the people that are retiring every day is increasing dramatically. I'm sure you see that too. And so I feel like while there are going to be people that don't want to live in this type of a setting, I think there's going to continue to be people that do, though, just because of the sheer volume of people entering that retirement phase of their life and needing an option. So I think, we may have to, adjust the way we do some things to accommodate a different generation of folks that are entering into retirement. But I think the population, the market's going to be there, long-term care and otherwise. Now, if you go back to the nursing home, I don't know what Medicare is trying to do. Medicare might be trying to close nursing homes. So President Biden and all that he's doing with long-term care, it's not conducive to healthy operation. So we'll see.
Any other questions for Kelly? If not, Kelly, thank you. Anything from the foundation?
All of our board members and the donors within the foundation, a lot of them are going to be receiving a request for support. It's really our first major project since we did electronic health record back in 2012. But the hospital is trying to replace all of the beds upstairs, and so we've got about a $180,000, $190,000 project for Share Medical Center. Half of that is available, and we're going to have some letters go out and make some phone calls, and this should be happening here in the next week or so, asking for help raising the other half. So.
Okay. All right. Thank you, Kelly. Anything from St. Anthony's? No. Next is the city council report. Greg?
Okay, I left my minutes. It was a big meeting, so I'll try to hit all the high places. We filled Connor Naughton's position on city council. What's his name? Garrett Lahr. He teaches at the school, I believe, or has something to do with the university. Seems like a really good guy. Haven't got a chance to visit with him personally, but anyway. We got that spot filled. It'll be for 6 months till the upcoming election. Most of the council meeting was discussing water issues. I don't think the city is going to be in as bad a shape on the water meter issue. What we got, I don't want to use the word stuck with, but we're in a situation where all of our automatic readers are failing at a rate that is causing the workers to have to manually read more and more meters every month. Anyway, they're very expensive to replace. We've got some grant money, so I don't think it's not going to be the millions that could have been because of grants. So we're moving along with that. Nothing's been decided there. We're into some discussion with the city of Capron on the water line. We're operating on a contract from the early 70s, and that's still in process. The city manager position is moving along. Nothing's been done yet. We're going to be talking to another person Thursday night. So we may be making headway in that. The city pool design was accepted, so that's in the works, and we're making headway on that. And we recognize some city workers for a bunch of the water issues in town. That planning is an ongoing deal on how we're going to deal with some of that. But other than that, that's part of the meeting. It was a pretty good meeting.
Well, Greg, thank you for sharing that with us. First, I guess I'd like to recognize there's several Northwestern students here tonight observing, so thank you all for being here. Hopefully you gained so much knowledge that you don't know how to put it all on the paper. But we're glad to have you here this evening. One other thing I think from finance, and maybe you mentioned it and I missed it, but the auditors are here, and next month we should hopefully have our cost report.
I didn't talk about the cost report, but we should have it done.
Hopefully so. All right, well, at this time, I'm going to make a recommendation that we head into executive session, and that is the next item on here. We will need to vote to approve to head into executive session. So I would entertain that motion.
I make a motion that we enter executive session to discuss the homestead.
Second.
I have a motion by Dr. Brown and second by Dr. Simon for the approval to go into executive session in accordance with Oklahoma Statute Title 25, Section 307B1 to discuss the homestead agreement. I would like all of the board members, plus Drew and Candace and Rosemary, if you would, and John, please stay. The rest of you, thank you for being here. And if there's anything we can do to help you guys, please let us know.
Call the roll on that.
I did not. You're right. Roll call vote, please.
Gaspard?
Yes.
Simon? Yes. Brown?
Yes.
Bowman?
Yes.
That's why we pay you the big bucks.
Right, yeah.
All right.